increasing body weight increases these enzymes in the blood. Which enzymes does it improve mainly? It mainly increases, the ALT. The AST increases slightly, and the gamma GT doesn't increase very much at all. This is very common in the Australian surveys. If we look at who has elevated ALT levels in the second set of bars, if you're of normal weight, less than 5% of Australians will have a raised ALT. Whereas if you're obese, 20% of Australians will have a raised AST. So you're 4 or 5-fold more likely to have a raised ALT if you're obese. Now in GPs are told in educational articles that about 30% of their patients have what's called fatty liver disease. And this fatty liver, this obesity which is reflected in a fatty liver, occurs more likely when you're obese, a type 2 diabetic, insulin resistant, have dyslipidemia, raised triglycerides, hypertension, this metabolic syndrome. So metabolic syndrome is associated with fatty liver. True in humans, well, in this analysis of what are the major things that determine who gets fatty liver, it's soft drinks and cakes and sugary foods. What's the importance? Well, the fatty liver it doesn't just cause fat in the liver. The fat in the liver causes changes in the way the liver can function, that each individual cell can function, and it will cause stress and inflammation within that cell. And chronic stress and inflammation will lead to fibrosis and scarring. So a fatty liver leads to hepatitis and leads to fibrosis and cirrhosis. So 30% of Australians have a fatty liver, and of those patients who we previously didn't understand why they were getting cirrhosis, it seems like the pretty obvious reason is because they've got a fatty liver due to obesity. The way that we can tell the patients that are progressing because they've got chronic liver disease which does not rest is through that AST to ALT ratio. The higher the AST is with the ALT, the more likely you are to develop the fibrosis and cirrhosis. Now, when you have a fatty liver, what changes in terms of the way insulin works? So in the liver, we can see that patients with fatty liver, the insulin doesn't work as well in terms of being able to move glucose around. But if we look at liver tissue, adipose tissue as well, it also doesn't respond to insulin when you have a fatty liver. So your fat tissue doesn't work properly if you have a fatty liver. How does that work? And not only that, but when you have a fatty liver, your muscles don't respond to insulin as well. When we look at the types of fat that are in the liver when you feed with sugar or sugar equivalents, those fats, the palmitic acid and stearic acid, those fats are not only in the liver, they're also in the pancreas and muscle and the heart. Whenever you have a fatty liver, that's not the only place that's accumulating fat. It's accumulating in every organ in the body. And that's why muscle doesn't work as well when you've got a fatty liver, because you've probably got fatty muscle as well. Exactly the same fat's accumulating. So we really have to think of fatty liver as part of the metabolic syndrome, and you do not only have a fatty liver with an insulin-resistant liver, but you've also got fatty other organs with insulin resistance right throughout your body. So what can predict whether you've got a fatty liver? Well, you can do imaging by MRI, that's the best way. But other than that, there are some fancy formulas, but ALT alone will predict it. ALT alone is the very likely predictor of fatty liver, as we've sort of discussed.